So we move on to our final session and our final speakers. Uh, Definitely last but not least, we're joined now by Nicola Cage from Maggie Sargent and Associates in Community Case Management Services, and Popat, who's Ops Director and Registered Manager at Biz Services. So welcome, Nicola. Welcome, Eki. And we're going to talk about people and talent, which sits right at the heart of the delivery of so many services that are crucial to the neuro-rehab community. But before they do that, as you've seen with all the other panelists, Nicola and Eki, I'm going to ask you just to say a few words about yourself, your organisation, your areas of specific interest, and then we'll maybe go on to a few questions. Nicola, if I could start with you, please.
Good afternoon, Alistair. Hello, everyone. I'm Nicola, and I've been involved in brain injury for over 20 years. I first met Maggie Sargent in her capacity as an expert witness. And I worked with one client as a team leader for several years, and then was able to access a case management pathway. And I've been a case manager at Community Case Management for 13 years with Maggie as my supervisor, which has been a lot of learning for me. My particular interests are, in equal measure, making life good again for our clients, for which you need exceptional teams. And I'm also passionate about developing people and creating unique career pathways, not dissimilar to the one that I was able to follow. I'm in good company with Eki. So.
Fantastic. Thanks for that introduction, Nicola. And Eki.
Afternoon, everyone, and thank you to NR Times for holding such an amazing event. I'm Maggie Popat. I'm Operations Director and Registered Manager for the Biz. I've been with the Biz for 14 years now, and I started off as a cognitive rehab assistant, supporting people in the community with brain injury, and I have worked myself up, and now I'm Registered Manager. The Biz are the UK leading providers of cognitive rehabilitation and brain injury support services for the community. And we really pride ourselves on raising the standards for cognitive rehabilitation and really looking at the kind of evidence that's required, especially for medio-legal cases. So a lot of our referrals are through case managers and solicitors, looking for that higher level observation and record keeping. And I think my particular interest has always been around independent living assessments and trials. A lot of people were living in the community want to live independently with a brain injury, and it's always, I think, one of the biggest challenges of how you can do that. So we do a lot of work with case managers and solicitors about our LINK program, which is a 12-week intensive living program that you can do, and we use a triphasic approach to really evidence long-term needs and recommendations. So that's one of our biggest specialisms, and I'm really pleased to actually announce that we've actually started doing a research project as well, looking at the efficacy of cognitive rehabilitation in the community. So a lot going on in the biz world.
Great, thank you, Eki. So we're going to talk about people and talent, and I'll start with the question that I hope isn't negative and leads to, a positive discussion. So talent and shortages of talent, or the right kind of talent, is that holding back progress? And if so, how are you dealing with that? And how does the community deal with it? I'll come to you first, Nicola, and then ask Eki for her thoughts.
Yes, it's such a good question, and it's always something that we have to consider. Do we have enough people? Can we really staff teams as well as we would like? The answer is we're doing okay, but I think that might be the geography based, in the home counties. We've got a lot of people around, and we can draw creatively from universities that we have locally. But in different parts of the country, I think that might be a different story. So I think thinking outside the box, to use one of Mike's terms earlier, is something that we're probably, and I imagine, Eki, you're doing something similar. We're having to do creative thinking. You're having to come up with some innovative adverts. We're partnering with universities, partnering with colleges to access young people and people who may be looking to have a career change later in life, to find people who are willing and interested in coming into the world of brain injury rehabilitation and supporting people in the community.
We'll maybe come back to some of that innovation, Nicola. Eki, how are you finding things in terms of
I
talent
think
attraction?
talent is such an interesting word, because I think everyone will see talent differently, and I think it's multifaceted actually for us, because for us, our cognitive rehab assistants, the minimum that's required is a psychology degree, and they have some relevant experience. But actually, talent goes beyond just academic knowledge and experience. It's actually about job knowledge transfer and application. And I think that's where we find it quite tricky. Is sometimes we have the application or the applicants coming with the minimum requirement, but it's that interpersonal skills, especially in the community, that one-to-one cultural competency, the problem-solving skills, the ability to be actually resistance as well in terms of resilience, but also like boundaries. How do you uphold boundaries one-to-one in a community when you're only 21, 22, and you don't have necessarily those life skills that you haven't developed yet. So we find that really tricky in terms of actually getting the right people in. But I agree with Nicola, you do have to think creatively, and we've done something similar in terms of working with universities, and we actually have placement opportunities at the biz now as well, just because you have that continuity with a placement, you have the year commitment, and that's also another thing is the commitment drive of things. No one wants to be in a job longer than 6 months. But we know working with vulnerable people, you need that consistency and continuity. So again, for us, it's about making sure that we are getting the right people in, but it's looking at assessing those interpersonal skills from the onset for us. So yeah.
I'm going to stick with you, Eki, and just ask, you talked about universities. Does it need to start at a much earlier age? I see a lot of industry sector bodies getting STEM education into primary schools even. Is there a big job to be done to make a career in neuro-rehab much more attractive and much more of an obvious choice?
Absolutely. I think it can go much wider than we're already doing right now, but I just think there's a lack of awareness around community work as well. I think there's a lot of knowledge around neuro-rehabilitation in terms of psychology, AP pathways, or clinical routes, but actually like the therapy routes or the community work, I just think there's a lack of knowledge around that. I think everyone just goes down the clinical route. So again, I think there's a lot more scope for education around from an early age of actually what the different roles in neuro rehab entail. And it's not just I suppose the conventional ones, like the psychologist. So absolutely. But I think I know back in the day when I, used to have parents come in and tell, I don't know what they call them, but, you used to have like parents coming and tell them about their jobs, but actually having more of that, I think that's been lost. Actually teaching children about different career pathways and actually having those open discussions, I think that would be fantastic.
Nicola?
Yeah, bring your parent to school day. I bring my nephews to work quite often, and they're very knowledgeable. But it is, I suppose, it's getting people out more. With some of the teams that we have, it's making sure clients are out and about, and people are sharing by word of mouth what they do and how they attain job satisfaction, and the things that they might be working towards. Maybe some of the way I would sort of describe it in some of the teams, we have what I would consider kind of grid support workers, so career therapeutic workers, whether they're rehabilitation assistants or buddies, whatever word we're using. And then you can have these sort of OT students and physio students rotating off the ends, who might be with you for a year or two, either as part of their course or earning money during their degree. And what's great about that is that trickles back to their lecturers, and we get to go and do little talks in the university in Brooks and in one in Birmingham. And I think it's just trying to spread the word, isn't it? It's us, instead of looking inwards, looking outwards. And maybe we need a blockbuster movie another blockbuster movie on supporting people was the one that was The Upside, the gentleman who was quadriplegic. It was a really good film, wasn't it? It really got people thinking about whether they could work with somebody in a different way. And I think I think it could be interesting.
Yeah, that's good. I think even social media, if I'll be honest with you, I think there's a lot of work that can be done on social media. And I know a lot of our clients are actually now becoming a lot more confident to tell their stories on social media, or become more, they're more technology equipped than I am, but they actually use that as an opportunity to share their stories and actually connect to a wider network. So again, I think there's a lot more that can be done from the social media aspect as well, raising awareness.
Absolutely.
And just moving on to teams and how you build teams. Thoughts on how you develop multifaceted teams that are in a position not just to meet patient and client demand, but to anticipate it and build models and developments for the future. So building teams, Nicola, do you want to kick off?
Yeah, multifaceted teams is so elastic, isn't it? You need, like I said about the grid, you're going to need some people who are staying there a good long time on the team. Maybe people who are really rooted in that area, in that geography, who know the area where your client's living. But you also need other people who are coming and going, because then you're also practicing the relationship and getting people used to change, whether it's established team members or your client, that you're used to building relationships. So how you do that, I think, is looking at people's skills and their passions. And also one of the things that we've tried to do, and I'm sure Ecky's doing the same, is share support workers, therapeutic workers over different clients, so that you're sharing skills, you're sharing experiences. And obviously that comes with challenges, but I think at the level that Ecky and I are working, it's really dynamic management, supervision, so that people have really strong boundaries, but are bringing the best of themselves to one team and then maybe sharing it with another.
Yeah. I echo exactly what you're saying, Nicole. And I think it is also about having those open, transparent conversations constantly with team members about what is their skills, what are they passionate about. And we do a lot of work around one-to-one support around that as well. And Natalie, the director, she's excellent. So I could actually say all of our management team at the Biz have progressed from cognitive rehab assistants. So all have at some point done the grassroots, but have what we've seen the skills or the potential and the progress. So I think that's really important, to see that progression within a workplace, and knowing that actually my skills are being valued or seen, and then I have a pathway to do that. So I think it's having those open conversations, and when you do see the potential, acting on it very quick.
Yeah, and recognition, I think, is so important, and helping people to continue to learn. Like you just said, whether they're progressing their own pathway, or they're seeing their colleague being helped. Because some people are very happy because maybe they have a busy life with their families and small children, but they would think, oh, actually, in a couple of years, I'd like that opportunity too. But if they see it happening, the commitment, I believe, we're extremely fortunate in our line of work, because people who come into this work, if we can attract them in, actually will give a huge amount of themselves, and obviously with emotional distance regulation and all of that, but and recognizing them for the work that they're doing and making a difference. And I think a lot of people want that in their work.
It's interesting. I think particularly with the generation we're seeing now coming through into the workplace, they do want to have a sense of mission, and they want to know that the work that they do will deliver social value. I think that's much more so the case than probably any time in the past.
I don't know. I probably would differ. I think it depends. I think a lot of the candidates that we get, they are on a particular journey and it is down the clinical route sometimes. So sometimes they can see biz or this rehab, neuro rehab as a bit of a stepping stone. So sometimes it can be seen as not like the commitment Nicole was talking about, is that they can just see this as, okay, I'm here for a pit stop and I'm going to go and do bigger things or, you know, better things. So again, I think it's a different mindset from everybody. But I see a big shift in that kind of, you know, wanting to fast track progression a lot. And I think there's that, and I think it is again the generation of seeing social influencers on social media making money very quickly and thinking, oh, I can get you know, rich quite quickly. But actually it's about working hard and actually getting to know your clients. It's a different I think a different field completely. So I think there's I would agree and disagree.
Yeah, I think you touched on there are no shortcuts to experience, and everything's so easily available right now, so accessible. And of course you kind of, I'm sure, you know, you'll dial into knowing who's going to stay and who's probably got one foot lightly touching. And of course they will have brought a raft of experience and lots of good energy, but it's a different quality in the relationship. And in some of the teams that we look after, you know, we'll have support workers who are there 10, 20 years, working really well, doing amazing work, tracking their clients, growing up together. But you also, the challenge then is to keep that fresh and not for it not to become the fur-lined rut, where people don't grow and grow for themselves. And when we're talking about trying to make people's lives good again, and the support teams, therapeutic workers are role modeling that either in their relationships. So then it's keeping that energy up.
I suppose what you're both underlining is this: attracting and keeping talent is a process, not an event. You've got to work at it day after day, week after week, month after month. Hey, we've talked quite a bit about technology throughout the discussions we've had today. Is that playing a part in your thinking about how you develop the capacity required to meet client demand?
I think I've seen it, the use of technology and the use of actually AI on our application forms. It's been very interesting how that has been used and how we have to also be mindful that if our people are using AI and not actually completing an application form or cover letter in their own words, how are they going to then deliver the support that we require, or in an interview, how are they then going to be differing in their approach? So we've seen technology in that phase being used a lot more readily, and it's very, very challenging because you see they have the good skills, they have good relevant experience, but then they're using AI to mask their own skills and ability. And how do you use it effectively? It's not saying that we can't avoid it, but it's how we then incorporate it, make it, that we can manage it. So that's a big one for us, AI.
Yeah, I agree. I was like, I've seen that written before.
Yeah, exactly.
But you can't kid a kidder, can you? So I think when you've been doing the work for a long time, you can also see when people are very genuine. And I think it's important.
So, Nicola, I'm moving quickly on from technology.
Yes.
Tell us your thoughts on the challenges, but particularly the opportunities when it comes to recruiting and developing that next generation of practitioners and those that will support the neuro-rehab community.
So hugely passionate about it because I love it so much. So for me, talking to clients about it's okay to have a great physio student or OT student working with you for a couple of years, because you're training the next generation of physios and OTs, and you're luring them into neuro and away from all the other disciplines. So I love that. I think also ensuring that there's lots of interesting things going on and to do, and talking to people, helping them with other skills, offering counselling training, which might not be directly involved in their work, but of course they're going to be working on their listening skills, offering reflective practice, really good space together with neuropsychologists where we can talk about the work and the practice, and elevating the role of the support worker, the rehab assistant, the whichever word you're going to use, because if you say carer, that would get my back up quite strongly, because that is not the work that we're doing, and that is also not helping the person who's going through the long journey of rehabilitation and continuing daily to struggle. So for me, it's about this lovely synergy, and if you can explain it to people, you can hook them. This synergy between they're piggybacking on your brain for some of the things that they need, but when they can do it, you magically step back and they can do it themselves, and they have the win and the achievement, and you've been a teamwork and you've collaborated. But elevating that role and people seeing the worth in that and feeling the magic, because it is really magical, because Eki and I have both done it, so we know. And you've made a difference and you've watched that play out. So if we can get in front of people and explain to them, then they'll be hooked.
Fantastic, Nicola. Eki, your thoughts on the challenge and the opportunities?
Yeah, I think one of the biggest challenges is what Nicole said there, is that just seeing it as caring, or it's more than just personal care. A lot of people just see rehabilitation, they think physical. They don't see the work that Nicole just mentioned, the actual kind of interdependence work that you do, multidisciplinary work, that kind of building rapport with someone one-to-one in their own home is special, and actually a privilege. I see, and I think people take that for granted. And I think that's one of the biggest challenges, getting that message across of actually what neuro-rehab actually is. So again, like you said, Alistair, I think going back to much earlier and instilling that would be great. And I think that's one of the biggest challenges at the moment. And I think also, just from the placement idea, is, going back to, just the modules on these degrees as well, that I want to, I'm very passionate about this. I don't feel like there's enough work done on the degrees around neuro rehabilitation or brain injury, even within schools. We know how many teachers are struggling out there who are not equipped with the knowledge of how to support children with a brain injury. So again, I think that's one of the biggest challenges as well, is not enough education for the people actually doing the work. So again, I think that's one of the biggest challenges. And I think for me, I think it's, I don't know if you find this as well, Nicole, but the people that come in to do this work are very young. They're still learning, and I think there's such an expectation on role modeling. There's a lot of section of modeling appropriate behaviors, but some of them haven't had that experience. So a lot of them wanting to do independent living work, and when they haven't even paid bills or lived independently. So again, how are we expecting the support teams to be able to do that if they don't have that experience? So it's actually we have a duty of care to make sure that we are putting the right people in there. They are confident, competent people. So that goes back to the talent question. It's not just about seeing a degree on a paper and some experience. Can they actually apply it? And I think that's where we have a duty of care to our clients. And I think that's one of the biggest challenges. It's not one size fits all. Every client needs something different, and making sure that we are meeting that is very tricky, but rewarding. I love it when we get it right.
Eki, Nicola, thank you so much for sharing your experience with us. It's been a pleasure to listen to you speak so passionately about something that is so important both to the community and obviously to both of you. So thanks very much for joining us today.
Thank you for having us.
It's a pleasure. Thank you.
So Nicola and Eki were our final speakers today. I hope for everybody watching you've enjoyed this NR Times live event. I'd like to say a big thank you on behalf of NR Times to our sponsors QEF. Obviously, I would like to thank our fabulous panelists for giving up their time so willingly and talking so frankly about their experience and their insight as well. And I'd like to thank our audience. All those of you that are watching, please When this content and the clips from today and the entire session is posted on YouTube and on the NR Times site, please share it as widely as possible. It deserves to get seen by as many people as possible. And for those of you that ask questions that I wasn't able to get to, we'll pass those on to the team at NR Times, and they'll have a discussion with our panelists, and hopefully we'll get some answers posted on the NR Times site imminently. So thank you once again to all of our panelists. I should say, as we draw the session today to a conclusion, that the work of NR Times is made possible by our members, and NR Times is absolutely focused on sharing the rehab experience and reaching out to the rehab community, giving neuro-rehab a really loud and influential voice, building relationships, referrals, helping to recruit, going back to our last session there. And on behalf of NR Times, I'd like to express our appreciation for all the support we get from the community, from our members, and all those organisations that contribute to the work of NR Times. So I'd encourage you to talk to the team at NR Times. If you'd like to talk to them about how you can work together with them and contribute to the work that they do, then please contact them through the NR Times website. All the contact details are there. So that represents the conclusion of our event today. There'll be more events coming down the line. Thanks once again to everybody for watching, and enjoy the rest of your day. Thank you.